Welcome back to LCME and Me, a primer about LCME accreditation. Today we're going to talk about curriculum oversight. So who has responsibility for the oversight of the curriculum? How does that happen? So we're going to start off with a question so you can answer and see if you know the answer. According to the LCME, which group of faculty have responsibility for the oversight of the curriculum? Do you think it's A, the course directors, B, the curriculum committee, C, the entire faculty of the College of Medicine, D, the Office of Medical Education, or E, the tenured faculty of the College of Medicine? Which one do you think? So it's actually B, the curriculum committee. And it's officially called the Medical Student Curriculum Committee, but we often refer to it as the curriculum committee. And this is our way that we meet this LCME expectation of a faculty committee that has responsibility for the overall design, management, integration, evaluation, and enhancement of a coherent and coordinated medical curriculum. So that's our curriculum committee. So as we go through these questions about the curriculum committee, see if you know the answers about how the curriculum committee works. So where does the authority come from for the curriculum committee? It's actually from the College of Medicine rules of the faculty. Who's on it? Well, both basic science and clinical faculty. We have faculty representative from all of our campuses. We have students on the curriculum committee. Are faculty appointed or elected to curriculum committee? Both. We have both appointed members and elected members. What are the subcommittees that curriculum committee breaks out into? We have three. We have a core principles subcommittee that deals with first and second year courses, the core principles phase. We have the application advanced development subcommittee that deals with those two phases, so third and fourth year. And then we have a student evaluation subcommittee that provides a student perspective about courses and clerkships. So who votes on curriculum committee? The appointed and elected faculty all vote. The students have 2 votes. And the chair of the committee or of a subcommittee only votes in the case of a tie. And importantly, no other deans in the College of Medicine or Office of Medical Education leadership have votes. It's really the appointed elected faculty and the students. And per LCME, our curriculum committee has responsibility for oversight of multiple different parts of the curriculum. So our program objectives that govern everything that happens in the curriculum, the objectives for each course and clerkship, the content and instructional methods that are taught in those courses, the quality of those and the outcomes that those different courses produce, the teaching that happens from faculty, residents, the integration, both horizontal and vertical, meaning across different courses within a phase or across different years and phases in the curriculum, the outcomes of those different sections of the curriculum and of the curriculum as a whole. And not just oversight, but the curriculum committee has to have ongoing monitoring, review, and revision. So an ongoing process to do that. So how does that happen? Well, we have 2 big ways. One of them that you may be familiar with is our QA, or quality assurance reviews. And that's where all of the different aspects of the course or clerkship are reviewed. So the curriculum committee is looking at the learning objectives, the content, how that's taught in different instructional methods, the quality of the faculty and resident teaching, the overall quality of the course or clerkship, the outcomes of it. And all of that review of a course in our QA review process happens in a curriculum subcommittee. So either in the M1, M2 one or the M3, M4 one. But we also have bigger picture reviews of aspects of the curriculum to have that ongoing monitoring and review. So we have program reviews, phase reviews, thread reviews. Those look at how are our program objectives doing and are students meeting those? How well are we doing with integration across different courses and phases? How are these sections of the curriculum, these big phases doing, are preparing students for the next phase? How's our overall curriculum doing, preparing students for residency and future practice? And all of these bigger picture reviews happen in the full curriculum committee. So what's your role as a course or clerkship director throughout this process? Well, obviously you're critically important in this QA review and in the course that is being reviewed. And the roles that the LCME uses, or the terms they use for those roles, are these. So you as a course or curriculum director are designing all of these different things that are reviewed, the learning objectives, the content, the instructional methods. You're helping develop what's going to be taught and how it's going to be taught. You're also reviewing those things yourself. So you're doing an internal review within your course or clerkship that helps feed into and support the QA review that curriculum committee is doing. And you're also recommending changes. You're seeing how are these aspects of my course working? What do we need to change? Do we need to add something or adjust something or revise something? And you're making those recommendations to our curriculum committee. So you as a course or curriculum director have a critical role throughout this whole process. So let's unpack that a little bit more with an example. Imagine there's some type of gap that's identified in a course or clerkship, an area that needs to be taught a little bit better, or a new area that needs to be added, or something that needs to be revised. And so you as the course or clerkship director look at the outcomes of your course, you identify this gap, you design a session to address that. You say, okay, we're going to add this new lecture, or we're going to add a workshop or revise this session to better meet this need of this improvement. Then you implement that, look at the outcomes of that, reflect on, was it effective? All of that is then fed to curriculum committee as they review all of the aspects of your course throughout the QA process. They look at the action plan that you've developed for your course. They make an action plan for the course that may address this gap if necessary. All of that then is fed back to you as the course or clerkship director. And so that's how you as the course or clerkship director are critically involved in designing these things, making a plan, reviewing it, making recommendations, and then curriculum committee still has oversight throughout the whole process. This oversight topic is definitely worth paying attention to because it's something that's gotten more attention in LCME reviews as something that's marked as unsatisfactory. So definitely one to pay attention to. And not just review of these things, but LCME also expects that changes happen. So the LCME doesn't want this to just be we've reviewed it, we've checked the box, we've reviewed it, but this should result in change. That's the whole point of doing the review, is to continue to improve. And so, in other words, that QA process should result in concrete changes. It should result in changes that the next time the course happens or for the next academic year. And the term that LCME uses for this is continuous quality improvement. This is one of those acronyms that we talked about in the first episode. So that CQI is constantly making changes, making iterations to the course, and making improvements based on the reviews that are happening. So I can imagine an LCME site visitor asking, what happens based on curriculum committee's review of your course? And so thinking about, how would you answer a question like that? How would you answer, how you describe how you would make changes based on curriculum committee's review? The other related concept is LCME expects that the appropriate standards are set by faculty member with the right knowledge and expertise. So what does that mean? That feels a little bit abstract. So for individual courses, it means determining things like, what's the standard a student has to achieve in the course? Or in other words, how is passing determined in the course? And how is that standard for passing determined? For the curriculum as a whole, it's things like, how do students progress from one phase to the next? How are the graduation requirements determined? So those are the kinds of standards of achievement we're talking about. And so the right faculty with the right knowledge and expertise have to set those. And so for individual courses, that's your expertise as a course or clerkship director is critical in setting that standard. For the curriculum as a whole, it's the expertise of curriculum committee members. This is also why new course and clerkship directors are approved by curriculum committee, so that curriculum committee can have oversight to make sure that that expertise is in place for you as a course or clerkship director to set those standards. So lots of checks and balances in place. So in summary, curriculum committee is responsible for oversight of the curriculum. The QA process is the main way that happens so that curriculum committee can oversee individual courses. And your expertise as a course or clerkship director is absolutely critical in both setting the standards of achievement for your courses and clerkships, but also implementing CQI for your course to continually make improvements. So thanks for joining us for this episode, and look forward to other episodes as we cover other elements.